Okay, so we're going to do a procedure on the ear where one can see some scar tissues developed along the helical rim. This is usually a reaction to an infection or inflammation, in this case a piercing. The issue is to remove that tissue and to let it heal without reformation of the scar tissue. It's helpful to have a dressing that applies pressure to minimize the risk of recurrence and to minimize any chance of bleeding in this area. I'm going to demonstrate the use of a heat-sensitive, malleable ear dressing. This could also be applied to skin excisions for cancer or an auricular hematoma, better known as cauliflower ear. Okay, so here's the external ear again after the surgical excision of the scar tissue. There's been a little flap here and a second flap behind the ear. And now I'm going to apply the malleable pressure dressing, which has been heated in water. I'm going to let it conform to the shape of the ear. And I'll hold it while it dries, or it cools off. So here is the ear dressing as it's cooled off. It's turned a little more white and it's become more rigid. I've contoured it around the external ear cartilage so that it will hopefully hold in place, but I'll probably add a piece of tape to ensure that it stays in place for the next week. I'm also going to inject some steroid into the soft tissue to avoid scarring. I can do this through the openings of the mesh. So now I've applied a Band-Aid over the underlying dressing. That malleable, heat-sensitive dressing measured approximately 4 centimeters in length and 1.5 centimeters in width.